Everybody, my name is Dr. Amruta Athale and I welcome all of you in this new webinar in which I will be explaining the Ayurveda principles of healthcare. Before I begin with today's topic, I would like to introduce myself. My name is Dr. Amruta Athale. I have completed my MD and PhD in Ayurveda. I am practicing in the city of Pune, which is situated in the state of Maharashtra, which is in the central part of India. So I do have two types of services. First, being a physician, I am consulting patients all over the world, and another sector of my practice includes academic work. So I'm passionate about educating people all over the world for self-care and for patients' care. So I do have my independent academia via which I educate people from more than 30 countries now. I will be traveling to Hengelo, Netherlands in the first couple of week of May. During this visit, I will be offering some programs in association with Miriam, and today's webinar is going to explain the opportunity for all of you to learn principles of healthcare. Okay, so if at all anyone would like to have more information about this course which will be getting offered, please feel free to contact Miriam. At the end of the session, I will be sharing her contact details. So please feel free to contact her if at all you feel interested in studying the subjects. And what you will be studying in this 50-hour course, I will be explaining in today's webinar. It's a unique opportunity for all of you to study in person with me. Okay, as I will be personally traveling there and will be teaching all of the topics which I am discussing today. Okay, so when we say Ayurvedic healthcare, so we need to see what is Ayurveda, what is health, and then what will be included in Ayurveda healthcare. Okay, so Ayurveda, as most of you must be knowing, is a science of life. So it's very beautiful word itself, right? Though we call, or most of the people consider it as a science of healthcare or a way of treatment of any disease, it is actually not only a science of disease care. It's a science of life, right? Ayu means life. Veda or Veda means the Ayurveda means the science of life, right? So it explains us the way of living life. Now, why it was needed to guide people about way of living life, okay? Way of living life. So these yoga, Ayurveda, these are ancient sciences and narrators of these sciences, right? Those people who created these sciences have always tried to establish a better healthcare or a better society by explaining the principles of living life, right? So those who have learned yoga or those who have learned Ayurveda before, they will be understanding this, that along with treatment of the diseases, it is extremely important to get educated in the method of living life, right? So most of the part of Ayurveda explains about way of living life, okay? So how we should lead the life, how we should live the life so that we can achieve health and happiness. So I think in the last webinar also I have explained it, and today I will repeat. All these Vedic sciences got developed, okay? All these ancient literatures got developed in order to establish a path for achieving happiness, right? And Ayurveda understood that health is the easiest way to achieve the happiness. Okay, that's why they tried to keep experimenting with behavioral pattern, diet pattern, spiritual healthcare in order to establish the health so that possibility to achieve happiness would be maximum. And in that discoveries, they understood a scientific method of living life, which includes diet, which includes taking care of digestion, which includes following different types of regimen, okay, which can lead all of us, which can take us to a path which has happiness for all of us, right? And with that happiness, we can live 100 years disease free. contribute for ourselves, for our family, for society, etc. Okay, so let's see what is there. So Ayurveda means science of life. So it explains us how to live the life. Now, what is life? Okay, we saw what is Ayurveda. Now, what is life? So, life is a union of our physical body, of our psychological faculty, of our spiritual faculty, which we call soul, and sense organ. So, if our life has these four aspects, then it is important to take care of all of these, okay, in order to achieve a complete health. Okay, fortunately, in Ayurveda, we have guidance for achieving health in all of these sectors except soul. Okay, many times I have explained it that Ayurveda considers that soul is not part of health or diseases. It's a silent observer of what is going in, what is happening in body, mind, and sense organ. So it never interact with human body when it comes to diseases. So as soul is out of the diseases, of course, soul is not a object of treatment, right? So there is no soul care regimens recommended in Ayurveda. They have believed that if the if the body, mind, and sense organ are at rest, are at peace, and are at harmony, naturally soul experiences happiness. Okay, that's why there are no separate principles, separate healthcare principles for soul. So all the healthcare principles are explained for achieving healthy body, healthy mind, and healthy sense organs. Okay, but as an individual, it is our responsibility to keep our body, to keep our mind, and soul and sense organ in harmony. So let's see. So Ayurveda is going to help us in achieving healthy body, healthy mind, and healthy sense organ. Okay. So Veda means knowledge, right? So Vedas are the most ancient scripts, literatures ever created on the universe. Okay. There is no older literature than Vedas. So it is well accepted fact that Vedas are the first ever literatures, first ever scripts which got created across the Indus Valley civilization, and they got established because when human beings started living life, there was requirement of guidance, guidance of different aspects of human life. And one of the major requirement for guidance was guidance in healthcare, right? Guidance in treating diseases, guidance in remaining healthy, guidance in immunity, guidance in achieving strength, guidance in getting rid of diseases, right? Guidance in rejuvenation. So that's why these needs which were which came into existence in the Indus Valley civilization right in the beginning of human race, Veda or Ayurveda came in for guiding people how to live life, right? So that diseases would be minimum, health would be maximum. Okay. So in Ayurveda, okay, which is one of the Vedic literature, health care is explained. Okay. Now, if you look into Ayurveda, as it is a Vedic theory, Vedic theories have always taken help from each other while structuring their own uniqueness, right? Similarly, Ayurveda has also taken certain principles from the other Vedic theory. Okay. One of the biggest principle of Ayurveda is its belief in man and universe theory. So what is man and universe theory? So they have believed that human beings are part of nature, right? So, and nature is continuously changing. So hence, if you want to remain um, in harmony, okay, if any individual wants to have peace of mind, peace of body, it's important to change when the season is changing. Season means universe or atmospheric conditions around us are changing, because universe is a bigger entity, so it is not going to change for every living being. So we need to change ourselves so that the universal changes will not create an impact in our body. Okay, so the Ayurveda is strong believer in the man and universe theory, which believes that man is a part of universe, or a human being is miniature of universe. So when I refer to man, it means man and woman both. Okay, so Purusha is often translated as man, but it means human. Okay, so human beings are part of nature, And when the nature changes, it is expected to change ourselves. Okay, how to change, what to change, where to change, and we'll be talking about it. Now, and another important theory, depending on which healthcare principles of Ayurveda are based on, is the dosha and elemental theory. Okay, so like I said, that man is a part of universe. Then what is universe? So universe is a bigger entity, and it so many things can be talk about it. But when it comes to practical application of Vedic theories, okay, so we can consider the five elements which creates universe, objects in universe. Similarly, as human beings are also part of universe, we are also made up of five elements, right? But they are present in an advanced form. They are present in a modified form in human body, which we consider dosha. Okay. So five elements, which are ether, earth, fire, air, and water, get transformed into vata, pitta, and kapha, and then structural, functional, physiological, spiritual aspect of human being gets handled by their presence in human body. So their harmony with each other reflects into health, while their disturbance qualitatively, quantitatively results into diseases. So that's why I always say, to follow Ayurveda, to understand Ayurveda, you do not need to enter into any lab, any laboratory. Human life itself is a laboratory for Ayurveda. It's a science of life, and life need to be experienced and learned. It is not an experiment which we need to do in lab. So this course which I will be offering is open for everybody who do not have any medical background. Okay, do not worry if you don't know anything about Ayurveda, about Western medicine, about human anatomy, physiology. It is not going to make any change. So whatever other people will understand, you can also understand all of it, right? So this course is very useful for those who want to start living life in a better way, who want to support their friends and family in a better way. And it is also extremely helpful for those who are already doing healthcare practices, either in Ayurveda or any other specialty like naturopathy, Western medicine, yoga, etc. Okay? Why? Because it will help them to give a structurized solution when they want to educate their patients, their clients in the principles of healthcare. Okay? Now, constitution is a combination of dosha which we all carry, right? And depending on this constitution, our physiology, our anatomy, our strength, our weaknesses, advantages, disadvantages are decided. So when you begin your journey in the field of Ayurveda, you often have heard this word, Prakriti, okay, which means constitution, right? So though doshas are three, Vata, Pitta, and Kapha, and they lies in our body, right, and mind. Okay, there are some other consideration of mind as well, which we will be seeing. But let's consider Vata, Pitta, and Kapha are practically most important elements to decide our health or diseases, and their combination decide our constitution. So Ayurveda believes that most of us are having two dominant doshas, and depending on these doshas, we do carry structural origin, functional aspect, physiological aspect, and eventually probability of pathologies in or diseases in our body. Okay, so understanding constitution is always going to be the beginning of our journey in the field of Ayurvedic healthcare or disease care as well. Okay, so when I will be there, I will be helping you on how to understand your own constitution, right? How to understand someone else's constitution. It's very practically and very extremely simple way of explanation is available, right? So I will be providing you some forms. So initial few days you can follow those forms and can understand the constitution of your for yourself, for your family members, for your friends, and those are in the healthcare for their patients or people to whom they are supporting, clients as well. Okay, now next. Okay, so what is the uniqueness of constitution? Okay, so Ayurveda always believe that though nature is same, okay, or eventually diseases are also same, but people who are suffering from that diseases, people who are getting exposed to that and to the environment around us are different. Okay, that's why one thing cannot be healthy for everybody, and one thing cannot be harmful for everybody. Okay, I always give this example. Ghee is healthy, but to whom, in how much amount, at what time is also required to know, right? Or let's consider nowadays nutritional industry is changing, right? And they always bring up new evolution. Like everybody is now saying that proteins are very healthy, but in how much amount, in which way, okay? Or is there anything else needed for getting better absorption of these proteins? Okay, all these things are can be understood when you understand the constitution, right? So constitution is individuality, holistic understanding of an individual. So like I said, though environment is same, food is same, or diseases are same, okay, but a person fighting with that disease, a person eating that food, or a person getting exposed to the environment might be different than the other one, right? That's why understanding the holistic need of an individual regarding life, regarding diet, regarding healthcare, regarding even mental care are different, right? And you need to be providing the solutions which they want, right? So what is unique about Ayurveda? That it considers every individual as a unique entity and provide the solutions which are unique which are unique to follow, right? That's why educating in Ayurveda can help us in providing the solution which people can follow, people can understand, and by which people can take maximum benefit, right? And their efficacy or the treatments which we recommend, the modifications which we recommend in their diet and lifestyle are can give maximum efficacy, quick results, and results in depth. Okay, that's why what is constitution? Constitution is understanding uniqueness of an individual. Okay, what are the benefits, what are the drawbacks, what are the advantages, what are the disadvantages, what are the limitations of any individual, and what could be a unique plan which can utilize their advantages maximum and which can minimize the disadvantages or shortcomings of any constitution is what expected to be needed before entering into our path of healthcare. Okay, so I will be explaining constitution. It's important how to understand the constitution in simple way. Okay, now the next is, like I say, this course itself is called as Principles of Healthcare. So it's very important to know what is health. Okay, so many of you might have seen all of these together many times, but I will repeat it one more time. So health is balanced constitutional doshas, balanced tissues. Okay, that means they are not excess in quantity, they are not insufficient in quantity, and they are working efficiently. Healthy eliminatory processes, so regular uneventful pleasant elimination of urine, stool, sweat is very important. Then the next is digestion, which is extremely important, right? So conversion of food into tissues depends on healthy digestion. So if your intake is good, but the processing of that food is not good, okay, its outcome is never going to be good, right? If the raw material is very good, but the machinery who is processing that raw material in order to convert it into the product is not good, it's of no use. That's why I always say this, that selection of food and digestion, nutrition includes decision of what is to be consumed and improving the way in which it is going to in which it is going to be processed. That means digestion. So nutrition is always incomplete without considering the digestion. Digestion plays a huge role in our health. Okay, and Ayurveda believes that health is incomplete without balanced digestion. Okay, we are going to study a sector of this course. A part of this course is designated only to digestion. What is digestion, how the food gets processed, how it actually gets converted into our tissues, what to do and what not to do to keep it functionally active, efficient, what to do when the indigestion is there, okay, how to support indigestion in simple ways in day-to-day life, okay, is all going to be discussed. Okay, then peaceful soul, efficient sense organ, and cheerful mind. These are psychological and spiritual, metaphysical aspects of human health. So actually, health is a combination of physical, psychological, spiritual, and social well-being, right? So to achieve all of these, there are various tools which they have recommended. So let's see what are these tools. The first tool is, okay, the so when we say health, what does it practically means? Okay, I always say this, that studying philosophical Vedic literature and studying its implication, its application in human life are two different sectors, and both are extremely important. Okay, so studying principles and studying their application, both are equally important. So either I will say that health is all of these, okay, or I can say health is balancing dosha, right? Why? Because doshas are going to decide rest of all the factors. So either you work on all of these separately, or you just work on achieving the balance of dosha. So achieving the balance of dosha is the shortcut to your health. Okay, avoiding the imbalance and making balance in doshas is the shortcut to our health. Okay, that's why understanding dosha is very important. Now, when I say that balancing dosha is health, then what are the factors which can create imbalance in dosha? I will repeat what I'm saying. If health is balance of dosha and health care means achieving balance of dosha and maintaining balance of dosha, then what are the factors which can create or which have ability to create imbalance in dosha? The most important factor is food. Okay, food is the element which has maximum ability to create balance or imbalance in dosha. Hence, selection of food, cooking of food, consumption of food, all has very specific and detailed rules in Ayurveda. Why? Because they have said that we are made up of food. What does it mean? We are made up of food and we are regulated by food as well. Tissues with which we are made up of. Okay, this physical body is made up of tissues. They get nourishment via food. And doshas, which regulate behavior of tissues, are also going to be changed by food. That's why food is the number one factor for which we need to be aware of. I always say this, that certain healthcare principle related to food, related to diet, related to nutrition should be taught in schools. Why? Because that is the age where you need to be alert, where you need to be educated about the healthcare, about the life, right? So slowly it is changing. So many schools of Ayurveda has yoga curriculum, little bit of diet curriculum, which is a very positive fact, right? But if not, we can become educated and then we can educate our children or our clients about food. So food is very explained in much detail. So they have considered food in solid and liquid parts. Then in solid parts, there are different groups like cereals, pulses, meats, fruits, vegetables, spices. In liquid foods, there are categorization like water, oils, cooking methods, sweeteners, okay, herbal wines. So many detailing is available about the food. Some of it I will be explaining. Then there are foods which increase the vata. There are food which decrease the vata. There are food which is going to increase pitta and kapha or going to reduce pitta and kapha. So these foods are actually tools of converting diseases into health. Because if you're struggling with certain conditions which are because of high kapha, okay, taking food which will reduce kapha itself is going to help you in recovering from these disorders. Okay, because health is balancing dosha and treatment is creating that balance via recommending various tools. And one of the biggest tool is food. So we are also going to learn how doshas gets formed in body when you eat certain type of food, and how these doshas are going to be relieved when you eat certain type of food, and what would be the benefits of these types of selecting specific food in relationship with dosha, in relationship with certain other factors which I will explain. Okay, so I will be teaching these different types of food, simple methods of convert of changing the properties which we are eating, what are the different ways of cooking, which foods you can combine together, which food should never be combined together. Okay, and if you do these kinds of incompatible or compatible combining of food, what are the benefits and disadvantages of that kind of cooking is also going to be taught. Okay, now next, this I have already processed. I have already said that food which we eat needs to have a correct transformation, and when this food gets transferred into dosha, dhatu and mala, and when this is in balance, this process is happening in harmony, usually a state called health is going to be achieved. But when the food is consumed well and digestion is not good, or food is unhealthy and digestion is also not healthy, then probability to have imbalance in dosha, dhatu and mana is very, very high. And that condition we refer to diseases. Okay, so that's why Agni and dosha, digestion and doshic balance are two most important steps in achieving health. Okay, and these two will be taught in detail. What are the doshas, what are their increasing factor, what are their decreasing factor, what are the functions of dosha, where do they live. Okay, then process of digestion. Agni means fire. Okay, and it is related to digestion. So what are the steps into digestion, what to do for increasing the absorption of food, what should be the food choices in supporting different tissues. Okay, is all going to be discussed. Now, this is a very unique aspect. So, preventive healthcare in Ayurveda includes seasonal regimen, daily regimen, ethical regimen, and preconception care. So, achieving health and maintaining it is also important. You cannot achieve health, okay, once and then you will neglect it in future. So it's an ongoing process till our death, right? So we need to respect our health by taking care of health, by following diets, by doing regimens, by taking care of digestion. So Ayurveda has very nicely explained preventive healthcare on 4 aspects. Okay, so they have said if you want to remain in harmony with nature, you need to change when the nature is changing. Now, when the nature is changing, so nature is changing when the season changes. Okay, so when the season change, our dosha and digestion change, right? So in different season, we have naturally different status of dosha, different compounding of dosha and status of digestion. Hence, to support that doshic status and the status of digestion, we need to change the food so that changing nature will not affect us, and we will keep having balance in dosha and good performing digestion. That is what is explained in seasonal regimen. Okay, seasonal regimen are extremely important to avoid the diseases which we nowadays are calling lifestyle related diseases. Okay, so and 80% of the funds, global healthcare funds, are getting invested only to get rid of or to treat behavioral diseases, or those which we call lifestyle related diseases. Okay, so it is 80% sector wise, it's 80% important in healthcare. Okay, seasonal regimen. So I will be explaining what are the different season, how to take care of the season, what diet you should follow in every season, what are the lifestyle related changes which are expected in the season. Now next is daily regimen. So like seasons are on the broad level, changes the atmosphere around us. One day is also not same. So mornings are different than evenings, evenings are different than afternoon. And the day-to-day practices like exercising, self-care practices like abhyanga, cleaning the body, cleaning the tongue, or taking meals, taking rest, taking different types of rejuvenating foods, okay, which can boost our energy, which can be rejuvenating to all of us, is what is taught in daily regimen. Okay, so how to spend your day is extremely important. And if you talk to any specialist, go and talk to endocrinologist, oncologist, metabolic disease specialist, or even infectious disease specialist. If you will ask them what are the reasons of these major diseases, they will all say not following biological clock is a major cause behind development of the diseases. So biological clock regulates our eating habits, our exercises, our resting, okay, doing spiritual practices, doing some self-care practices which do not need more than 20 minutes. Okay, don't worry at what time we should get up, at what time we should go to sleep. So all that is very, very scientifically explained in Ayurveda. Okay, and that is included in daily regimen. Okay, so that also will be discussed in detail, how to modify it for different types of constitution in different age groups is all will be taught. Okay, because we need to learn the practical application of all of these. Then what is ethical regimen? Ethical regimen is the method to take care of mind and sense organs. So I have always said this, that health is incomplete without taking care of mind. And Ayurveda believes that every disease is going to happen in body and mind. Eventually, both of them are going to get involved. So that's why there is no concept of psychosomatic diseases in Ayurveda, because every disease is considered psychosomatic. as mind lives inside the body, it's very difficult that it will not get influence from whatever is happening in body. Similarly, maintaining health in physical aspect is very difficult if the mind is not at balance. Hence, working with both of them together is very important. And you cannot segregate psychological care and physical care. Both needs to be followed together so that the complete harmony is established and we can experience peace and happiness in our day-to-day life. That will be taught in ethical regimen. I will quickly help you in how you can design your day and seasons in order to take care of body and mind. Okay. Now, preconception. What is preconception? So it's not going to be taught in lot of detail. It's a specialty subject. Okay, which believes that our parents become or play a major role in whatever we have, right? So, and if you take certain care in the preconception care, if the parents take certain care in the preconception level, they can change the kind of anatomy, physiology, etc., which the next generation is going to have, right? So this is a discovery which Ayurveda did before 50,000 years back, and now it is repeated in endocrinology. They believe that preconceptional part or even conceptional part decides future of 3 generations, okay, which Ayurveda already has established in a very scientific and very detailed way, which is also a part of preventive healthcare. So seasonal cares, okay, like I said, I will be teaching seasonal care in detail because the food, water, air, and energy which we get in different season is different. That's why its influence on dosha and agni is different, right? Hence, we need to find a balance between these two so that we don't have an impact from the ever-changing seasons. Okay. So I have explained about the daily regimen as well, ethical regimen as well. Okay. Now the another very, very important part, which is hot topic in the last 2 years, is immunity, right? So building immunity in childhood, in elderly, in middle age, building immunity for different organs, for different structures, building immunity for your weaknesses is very important, because in Ayurveda, immunity is not only against the infectious diseases. Immunity is your strength which can protect you from any kind of disease, whether it's an accidental disease, whether it is an environmental disease, whether it is a infectious disease. If you have good disease preventing ability, any disease will have minimum impact on ourselves. That's why learning about what is immunity and what are ways to build it is very important. So there are various options. There are certain diets which build immunity. There are certain lifestyle practices which develop immunity. There are certain herbal care which we can discuss that will build the immunity. Okay, so various aspects of immunity, its importance and ways to build it will be also taught, as it is very, very important to develop immunity so that we can stand firm when the environmental factors are not that supportive nowadays. Okay, so I have provided you what we will be discussing. So there is a document which we have created in which I have explained what will be covered in this 50-year program. If any one of you would like to receive that, would like to receive any further information on the location of this training, fees and rest of all these things, please contact on this email and Miriam will be more than happy to help you. If you have any doubt related to whatever I have discussed related to the program which I will be offering, please feel free to contact Miriam and she will be forward your query to me. Okay. Thank you for today. I hope I will have an opportunity to help all of you in these subjects. See you soon and talk to you and meet you in person soon. Thank you for your time. See you again next time.